Biosport, the one-on-one approach. Yeah.
Okay. On a more serious note, that is serious, but we're gonna get to some exercises, okay? So this is another foundational kind of series that we do for a lot of our shoulder patients and postural patients. So what we're gonna do is gonna take a resistance band. This is a tube actually, technically. So this is about light to moderate, nothing too heavy, okay? What we're gonna do is we're gonna approach this here. There's a few things I wanna say first. The closer you have your hands together, the more resistance you're gonna have within the tubing, okay? So start a little wider first. We're also gonna start with palms up. So again, external rotation in the shoulder. Again, freeing up that room in the AC joint, making sure that we get as much range of motion as we can. So once we have the palms up, about shoulder width apart or slightly wider, I want you to go ahead and close the hands. So you have a nice grip, okay? You see there's slack at first. Again, that shoulder height. And then from that point, we're gonna go ahead, keep the head forward, and then we're gonna pull apart until we get to a position where we're able to squeeze our shoulder blades back, but without shrugging. Okay, we wanna make sure those shoulders, those upper traps are not involved. We're just here squeezing and then coming forward slowly. So now this is elastic, so it's gonna try to pull you really quickly. So obviously control it on the way back as well as you go forward to the squeeze. So that's palms up, aka supination. Okay. We're also going to try a little bit internal rotation in the shoulder as we go ahead and turn palms down into pronation. Assume the same position as far as the width. Okay. Same height. We're going to go ahead and then pull apart from this position. Same end result. In our shoulder blade squeeze in the mid traps and rhomboids. A little bit posterior deltoid as well, since we have our hands pronated. Okay. Head always forward. And slow controlled forward. Those are 2 out of the 4. Supination, pronation, external rotation, internal rotation of the shoulder. So now we're gonna go ahead and do some diagonals, D1, D2, PNFs, different names for it. So to do that, we can start in the same position, and all we have to do is really go ahead, have one hand, almost both at like 45 degrees kind of. We're gonna have the top hand pulling up, bottom hand pulling down. If you notice, my thumbs are leading in each direction. One is up, the top hand, the other one's pointing down. We're gonna come here, start in the middle with some slack. And they're gonna go ahead, and then this one's going into that flexion as the right hand is coming down into extension. Okay, a little awkward at first, I'll admit it. We're gonna go ahead for the end result and squeeze back, okay? Keeping the arms relatively straight, and then forward, nice and slow, okay? And all we have to do is to the other side, make sure we even out everything, is just flip the hands and have the right one into that flexion, and the left one into extension. And then you want to get that same squeeze and slowly control it back to the center as we go ahead and have slack in the band again. Okay? Really good one. This is a foundational exercise we do for shoulder patients, postural patients. Make sure you start with one of these, see how they respond, and then we can get to other progressions that we mentioned before. Okay? Give it a shot. 2 sets of 10 should suffice. Again, you can hold it at the end if you want to. You don't have to just yet. That's another way to intensify the exercise. Give it a shot.